So Advantage plans sound great on the surface. No cost, no premium, dental, vision, massages, groceries, transportation, you name it. So, a lot of folks are enamored with these commercials, but I have a lot of my Hilton Head and Bluffton clients that are turning 65 that tell me, wait a minute, what's the catch? There's no free lunches. We've been around long enough to understand that. So today, I'm going to go through the pros and the cons of Medicare Advantage plans, break it down with simplicity. We're going to also compare the Medicare Advantage versus original Medicare, because we're in a Medicare supplement that goes with that. So this is Chris Dewey with May River Medicare, and we educate, we empower, and then we enroll, and we are part of your Medicare life from start to finish. So enjoy this video and get the truth about Medicare Advantage plans. So there's really only two paths you can go down, but the big thing is I'm going to share with you the feedback that I get from my clients, that I've gotten from my clients over the last 12 years about what they like about Advantage plans, and quite frankly, what they've called me up to complain about. So once we break down the good, the bad, the ugly of Advantage plans and compare that with original Medicare and a supplement, I want you to stay tuned, because at the end of this video, you can click on a link and you can get our free guide to Medicare Advantage versus original Medicare and Medigap, our free downloadable PDF guide. You can download that and keep that for free, all right? As well as for, I know a lot of your family members, ACA, Obamacare, and I am like a laser beam in this industry. I focus strictly and solely on health insurance, predominantly Medicare. Medicare for over 65, Medicare for under 65 disabled, which has been my specialty for many years before I moved to Bluffton Hilton Head. All right, so stay tuned. Today, I'm going to go through the pros and the cons of Medicare Advantage plans, break it down with simplicity. We're going to also compare the Medicare Advantage versus original Medicare. Okay, so again, there's only two paths you can go down. You can go with a Medicare Advantage plan, or you can go with a Medigap, or what we like to call a Medicare supplement plan with a drug plan. So this is the most important decision by far that you're ever going to make in Medicare. All right, so let's make it a wise one. First thing is, you can't have a Medicare Advantage plan with a Medicare supplement. You can't have both. You can only choose one, all right? So if you decide to go with a Medicare Advantage plan, you need to be aware that after your 6-month window, your Medicare supplement open enrollment window, that's 6 months from the time that you turn 65, or 6 months from the time that you enroll in Part B. So the month that you turn 65, or the month that you are enrolled in Part B, you have to go 6 months from that month. That's the only time, one time in your Medicare life, that you can get a Medicare supplement with no health questions or underwriting questions asked, no med checks. Before we dive into the pros and the cons of Medicare Advantage plans, I think we need to understand some important things about Medicare Advantage plans. So the first thing you need to understand about Medicare Advantage plans, easy to qualify for, all right? There's no health questions. There's no underwriting. You can have cancer, COPD, HIV, doesn't matter. The other thing you have to realize is you can't just enroll in a Medicare Advantage plan any time of year you want. For most people, the annual election period when you can change your Advantage plan, or maybe keep it, but you can shop it out, it's between October 15th and December 7th. All right. There are also special election periods for people that maybe move to a different part of the country and the Advantage plan isn't offered there, and a bunch of other special election periods as well. The next thing you need to understand is you must have Part A and Part B to enroll in a Medicare Advantage plan. It's not like a drug plan where you can have Part A or Part B to get a drug plan. With an Advantage plan, you got to have Part A and Part B, or you can't get it, all right? And the other thing is you must live in the plan service area. What do I mean by that? So there are some local HMOs here in Hilton Head where you have where you're restricted to certain hospitals and certain doctor networks. If you go outside the network, you pay 100%. Some of you have a regional PPO. There's some regional PPOs where you can go across to Savannah in Georgia or South Carolina. So, but you have to live in where the plan service area, in the zip code, the county where they offer the plan. Now, a lot of folks that I run into are from Ohio, Pennsylvania, New Jersey. They'll move down here with or upstate New York, a lot of those in Rochester, where they'll come down with a little HMO Blue Cross plan. And the thing is, they move down here so and the plan's not offered down here, they have a special election period where they can enroll in a new Medicare Advantage plan, or here's a secret, best kept secret no one's told you about. Cancer being awful health, move from Pennsylvania, New York, Ohio down here, and because the Advantage plan is not offered, the same one that in Ohio that you had or New York that you had, you can get a Medicare supplement with no health questions asked. I have saved a ton of people that have moved here that are in bad situations. They're having cancer treatments. Guess what? This is your lucky day. We don't have the Advantage plan that you had in Ohio, but we can get you the Plan G Medicare supplement, lowest premium, best carrier with no health questions. So that's I went off tangent there a little bit, but you got to live in the plan service area, okay? The other thing so with original Medicare, you have Part A and Part B. Now remember, your Part B premium is going to be $164.90. That's the Medicare Part B premium they take out every month for your Part B. What you have to remember is this, guys. Just because you decide to get a Medicare Advantage plan, otherwise known as Part C, you got to understand that you're still going to have to pay that $164.90. Okay, I had a lady that said, no, I don't pay that premium, the $164. She didn't realize they automatically take it out of your Social Security check. Most people that receive Social Security benefits when they turn 65, they automatically can take that out. They don't even realize that that's being taken out of their Social Security. You need to be aware of it. Just because you get a Medicare Advantage plan does not get you off the hook for the Part B premium. You still have to pay that. So one last illustration. Let's say you sign up for a Medicare Advantage plan. You have a $30 premium. The first thing that's going to happen each month is your Part B premium is going to be taken out by Social Security. Now, if you're drawing Social Security benefits when you're 65, they're going to automatically just cipher that right out of your Social Security check to pay for your Part B premium. It's automatic. A lot of folks don't even realize it. All right. If you are not drawing Social Security and you're going to hold off for a year or two or more, then you will have to enroll in Parts A and Part B, and you'll have to set up payment. You can either use Easy Pay, and they can have it come out every month, but a lot of folks just mail it in quarterly. Now, here's your $30 Part B premium. In addition to the $164 that Social Security is going to take out, you're also going to get hit with a $30 premium. So when you sign up for a Medicare Advantage plan, you're no longer getting your benefits from Medicare. What's actually happening is Medicare is paying a private insurance company to manage your care. So you're no longer getting your benefits through original Medicare. Your healthcare providers are going to send their bills directly to the Medicare insurance company, and the Medicare Insurance Advantage plan, the Medicare insurance plan, then becomes your primary insurance, your primary coverage, and that's why all providers must send their bills to the Medicare Advantage plan, all right? So just remember, guys, you enroll in a Medicare Advantage plan, you want to take that red, white, and blue card and stow it in someplace safe like your sock drawer. You don't want to show this card to doctors, hospitals, any providers, or what's going to happen is this: you're going to get a bunch of denied claims and you're going to have to sort out a huge mess. All right, because Medicare is not directly paying your claims anymore. So you're going to present your providers with your Medicare Advantage member ID card as long as you're enrolled in that plan. Okay? So another component of Medicare Advantage plans that you have to be aware of are smaller networks. With original Medicare, you have access to over 1 million providers, doctors, Mayo Clinic, Duke University. Anybody that takes Medicare, you can go there. With Advantage plans, you have what's called a restrictive network. Some of these networks have only a few hundred doctors and providers in one county. Others may be spread out for 4 or 5 counties and have 1,000 providers. You might even have a regional PPO Medicare Advantage plan like we do in South Carolina, where you have access to doctors in both Savannah and parts of Georgia as well as South Carolina. But you're not going to enroll in a Medicare Advantage plan that has multi-state coverage where you can go to a doctor in California and see one in New York. If you move to a different state, you can use a special election period and enroll in a Medicare Advantage plan in that area. Any time of year that you move, keep in mind, if you move to another place that doesn't have the Advantage plan you had, say here in Bluffton or Hilton Head, South Carolina, you can always enroll in a Medicare supplement with no health questions asked. The Plan G is the one you're going to go into, and you can do that with no underwriting. All right, now, the other thing is you want to stay in network. You do not want to go outside the network. You're going to pay much more with a PPO. With an HMO, a lot of HMOs have no coverage outside the network. So if you go to, unless it's an emergency, if you go to a doctor that's not in the network, you're on the hook for 100% of it. All right. So although Medicare Advantage plans have much lower premiums than Medicare supplements, you're going to pay a copay or coinsurance at the time of service whenever you access your healthcare services from your Medicare Advantage plan. These copays are listed in the summary of benefits, which you want to look at before you enroll so you can see how much you're going to pay for different services and procedures as you go along the way. So for example, you might pay $10 for a primary care physician, all right? A lot of these plans you're going to pay $300 per day for days 1 through 5. You leave the hospital for 60 days, you go back in, that $300 a day starts over again. That 20% right there, durable goods, cancer treatments, there's a lot of 20% coinsurance, which can really hurt your bottom line. If you got outpatient surgery, you had to pay 20%. That could be $700, $800 depending on the surgery. Specialist, you might pay $50, some are $40. This is just an example of how Advantage plans work. And up there is the RX, the drugs. You need to look up in your drug formulary if your drugs are covered by the Advantage plan. The lower the tier, the less the drug will come. One of the things that I see new clients that have told me they've overlooked in the past is they'll check their doctors, they'll check their drugs in the formulary, but one thing they forget to do is they'll check hospitals, medical facilities, places where you get MRIs and x-rays. One of the biggest things that I found is people that are used to their home health care or where they get their durable medical supplies like their CPAP machines or their diabetic supplies. It's just, you want to look at those types of providers, not just specialists or doctors, all right? So that's the basics of Medicare Advantage plans, what they are, how they work. I'd say probably 50% of my book of business is Medicare Advantage plans, the other half Medicare supplements. The reason why it's 50-50, my wife is a disability attorney. She's a Social Security disability attorney. So every time she wins a disability case for one of her clients, they have to wait 24 months, most of them, for it to be on disability before they are eligible for Medicare Part A and B. My average Medicare Advantage client makes right around $1,600 a month. That qualifies them for extra help for their prescription drugs. That qualifies them for qualified individual status, which means they get the $164.90 put back into their Social Security check every month. 2023 income limit to get your $164 back is, I believe, $1,660. The pros, let's get to that. Most of the clients that I talk to love Advantage plans for the simple fact that they have either no premium or a lower premium. Now, Advantage companies, Medicare Advantage companies have lower premiums than Medicare supplements in most cases. And these Medicare Advantage companies can set the premium at whatever they like. So remember, they're getting paid thousands of dollars by Medicare every month you're enrolled in the plan. So they can afford to offer you low or no premiums in the hopes that you join and they get paid by Medicare. So in return, you agree to use their doctor network. You'll pay copays or coinsurance directly to your providers as you go along. You go to get a doctor's visit or durable goods or a hospital or an ambulance or an office specialist visit or outpatient surgery or MRI. You're going to have a copay or coinsurance for every one of those things. Okay. This allows you to pay as you go for medical care. instead of paying a higher premium up front for medical care that you may or may not need, you pay as you go with these Medicare Advantage plans, okay? So what I like to tell folks is my people that are on a fixed low income, most 90% of those are disabled on Medicare. They can't afford $164 a month plus another $100 for a Medicare supplement plus a Part D plan, because a lot of these folks are getting assistance. So like I said, 50% of my book of business is Medicare Advantage, and 95% of those are under 65 on disability. Okay, so let's talk about the next pro. What's the next thing my clients love about Medicare Advantage plans? Well, I'll tell you, the simplicity of just using one card. They have one Medicare ID card. With original Medicare, you have a red, white, and blue Medicare card that you show your doctor or provider first. Then you have to show them your Medicare supplement or Medigap insurance, which pays after the supplement does. Then you got to show them your Part D drug plan, which is a separate card. So those are 3 cards. And a lot of times I will sell a standalone dental or vision plan, and then or a hospital plan to pay the hospital co-pays for these Advantage plans. So you could have 4 or 5 cards. A lot of folks don't like that. They like to consolidate all the Part A, Part B, Part D, dental, vision, have it all on one card. So the third biggest positive or pro that my clients tell me why they love Medicare Advantage plans is there are no health questions. So that's crucial for 2 groups of people, hugely important for 2 groups of people. The first group of people are those that are under 65, that are on disability. They're on disability on Medicare, because for folks on disability, they can't get a Medicare supplement. In most states, that are not even offered. In South Carolina, doesn't matter if you're 50, 60, 63, Medicare supplement is going to run you right around $1,400 a month. So it just isn't, it's not practical, it's not feasible. So Medicare Advantage is the way to go for people under 65. Okay, so Medicare Advantage, they don't want to pay 20% of everything with just original Medicare. There's no maximum out of pocket with just original Medicare. You just keep paying 20% of who knows what. So the other groups of people, the second group of people that really love the no health questions, there's somebody that was really healthy when they turned 65. They decided, you know what, I'm not going to get a supplement, I'm not going to get an Advantage plan, I like my original Medicare, I'm going to stay put. Then 2-3 years down the road, they get COPD, or they have congestive heart failure, or they have 2 or 3 drugs that are on the Medicare supplement carriers decline list of drugs, or they can't pass underwriting. So the only option that they have is a Medicare Advantage plan. All right. So the number 4 most popular reason why I'd say my clients like Advantage plans is what's called these plans have a cap on how much you can spend in 1 year for Part A and Part B services. This is called your maximum out of pocket. It's designed to protect you. Each plan sets their own maximum out-of-pocket limit, but Medicare, every year, they set their own limit on how these insurance companies, how high they're allowed to set their maximum out-of-pocket each year. For 2023, Medicare has set the maximum out-of-pocket limit to $8,300. Now, a lot of companies will go less than that, $7,500, $6,500, $6,000. So it varies. So every time you pay a deductible, a copay, or coinsurance for Part A and B services, the plan tracks your spending. If that spending reaches the maximum out-of-pocket limit, you're done spending for all covered Part A and Part B services for the year. The insurance company must now pay the rest of your covered Part A and Part B services through December 31st, and on January 1st it resets, and that maximum out-of-pocket, you have to start that over again. Okay, right? So remember, if you only have original Medicare, the red, white, and blue card they sent you, when you enrolled in Part A and Part B, you're going to be responsible for paying 20% of all your Part B services. That includes outpatient surgery, cancer, radiology treatments. And the thing is, with just original Medicare, there's no limit to how much you can spend in a year. you could spend $500,000. You're responsible for 20% of that $500,000. So Medicare Advantage plans, they don't pay that 20% either. You have co-insurance and co-pays for doctor's visits, outpatient, hospital, different things, but at least they've got a safeguard. With an Advantage plan, at least you got, hey, if I spend $7,000 this year, I don't have to pay anything for the rest of the year through December 31st. The insurance company has to pay that. Gives you a little bit of peace of mind. So if you have original Medicare, we might want to think about October 15th to December 7th. If you're not healthy enough to get in a Medicare supplement, you can enroll in a Medicare Advantage plan. So the very last positive thing that my clients sometimes get sucked into, but they do like about Advantage plans, is the extras, the dental, the vision, transportation. There are some Advantage plan companies now that are giving grocery cards out. So you get a $50, $75. My low-income folks get a $150 grocery card every month that they can go to Walmart and go grocery shopping. So these companies are taking Medicare's money and they're gift wrapping the Advantage plan with pretty dental and groceries and transportation and a personal emergency response. Help me, I've fallen, I can't get up. They're throwing some enticers in there, but make sure you keep your eye on the ball. Would you rather have an Advantage plan with a, let's say, $0 primary care, $15 specialist visit, but the big thing, the maximum out of pocket's only $2,900, hypothetically, $2,900, or would you rather have an Advantage plan that's got an $8,300 maximum out of pocket, that's got $1,000 in dental, $200 in glasses, and you get free over-the-counter stuff every 3 months? Let's say $100 worth of free over-the-counter. Are you going to go with the plan with all the extras with an $8,300 worst-case scenario for your Part A and Part B services, or would you rather go with kind of a plain vanilla plan with only a $2,900? So once you spend $2,900 at the hospital, at the doctor's, cancer treatments, once you spend that, you don't pay anything till after December 31st. Would you rather have the plan with the free transportation and over-the-counter and the cherry on top? You got to think about that. Extras are great, but you're not making a decision on your health care. You're not making that decision based on free over-the-counter stuff, groceries, or dental, all right? So earlier we mentioned one of the top reasons why people love Medicare Advantage plans is because of the low premium or no premium. However, Medicare Advantage plans often have a lot of back-end spending, and often folks don't anticipate or plan for this. Let me give you an example. Let's say you go to the dermatologist. Specialist visit, that's going to cost you, most of them are between $40 and $50. Let's say $50. Dermatologist is checking out your skin. He sees some things he doesn't like, so then he does some blood work. He orders that you go do some blood work, and then after that, he wants to send you over to the imaging center for an MRI. All right. A week later, you get the results, find out that it's not cancer, it's benign, but you still got to get the mole off your skin, and that's outpatient surgery. So you got $50 for the dermatologist visit, you got another $20 for the blood work. And then the imaging center MRI, it's a $300 copay, pretty standard for an Advantage plan, but I'm just giving you some general numbers I've seen before. And then a week later, you're not worried. You have outpatient surgery. It's day surgery. It can't be that expensive, right? But you didn't read your summary of benefits. And even though outpatient surgery last year was a $200 copay, they changed it on you. You didn't read your annual notice of change. And outpatient surgery, it's just like Medicare. Your Medicare Advantage plan pays 80% of the outpatient surgery, you pay 20%. Find out the surgery ends up costing $10,000, you're on the hook for 20% of that. You have to pay $2,000, and that's the kind of thing that can happen fast with an Advantage plan. All right. How I see with Advantage plans is you got some surprises. You could have a few healthy years where you see your doctor once or twice a year, and you're winning. Okay, but then on year 3 or 4, let's say you get cancer, you have to have heart surgery, physical therapy, which is like $40, $50 copay every time you go. That could end up costing you up to potentially $8,300, which is the max out of pocket for Advantage plans that Medicare has set forth for 2023. So you're going to end up paying thousands of dollars in coinsurance and copays on a bad year. It could end up costing you $8,300. Unlike a Medicare supplement, let's say a G plan, where the only back-end cost you have is a $226 annual deductible. Once you hit that, there are no costs, there are no copays, there are no nickel and dime for MRIs, CAT scans, outpatient surgery. You don't have any surprises. You can plan, you can budget. Okay, guys, so let's compare the popular Medigap Plan G supplement with a Medicare Advantage plan with a $6,700 max out of pocket, which that's about the average max out of pocket. So with a Medigap Plan G, let's look at our back end costs. How much do you pay for copays, for deductibles, for coinsurance? So the Plan G, it's real simple. You got a $226 annual deductible. Once you pay that $226 deductible, you don't pay any. There is no back end cost whatsoever. Let's say you're 68, so your Medigap Plan G supplements about $100 a month. That's about the average for my clients for a 68-year-old. About $100 for Plan G, plus the $226 deductible. With a zero Medicare, I've already spent more with a Medicare Advantage plan, go to the hospital for 3 days, than you would pay for the entire premium plus the deductible for a Medigap Plan G. Let me put it another way. Let's say you got a Medicare Advantage plan where it's 20% for outpatient surgery, very common. And if you look at your summary of benefits, they like to try to sneak that in on you. You go to a dermatologist, or even like stents are put in outpatient day surgery now. Forget about it. You have 1 day surgery. You're in the thousands now with a Medicare Advantage plan versus you got the $226 deductible on the back end, pay $100 a month, so you're winning again with a Plan G. You can budget. Things are predictable. There are no surprises with a Medigap versus a Medicare Advantage plan. Medicare Advantage is who knows what I'm going to pay, okay? So the next big thing is the biggest complaint I get every year right around October. I'll have people call me for assistance and say, look, these Advantage plans are hard to compare. There's a lot of moving parts. So Medicare Advantage plans are not standardized or the same across the board like Medicare supplements or Medigap plans, same thing. All plans must offer the same Medicare Part A and Part B services that original Medicare does. Each Advantage plan can set their own premium, their own copays, their own coinsurance, they have their own provider network, they have their own drug formulary, and they even have their own pharmacy network as well. So with some plans, you might have really low doctor copays, but then when you look at the hospital, it's like extravagantly expensive. It's very expensive. While one plan may offer low doctor copays, their hospital or their outpatient coinsurance or copays might be skyrocketing. Be on the lookout for things like paying a percentage. You don't want to pay a percentage of your outpatient surgery. Okay, same with cancer treatments. Most of these Advantage plans, it's a flat 20% percentage or coinsurance. So, you're going to hit your max out of pocket if you get cancer in all likelihood, okay? All right, guys, the next item on the list of things my clients don't like about Advantage plans, the next list on the cons list. We did the pros, now we're doing the cons. When you enroll in a Medicare Advantage plan, you're locked into it for the remainder of the year. You can only change plans during election periods, during special election periods. So between October 15th and December 7th is your fall enrollment period, or a special election period if you move from one state to another. That Advantage plan isn't offered in your new state. You can change during a special election period. Now, the lock-in period is something folks don't like, because if they miss something important during their fall enrollment period, they may not realize it until they're already locked in for the rest of the calendar year. If you enroll during the fall enrollment period and then later on you realize you messed up and you were enrolled in the wrong plan or a bad plan, then you have one more chance to go from an Advantage plan to another Advantage plan. That's between January 1st and March 31st. It's called the MA Open Enrollment Period, or the Medicare Advantage Open Enrollment Period. You can only change once during this time, all right? Advantage plan to Advantage plan is fine once between January 1st and March 31st. But you can also leave your Medicare Advantage plan and go back to original Medicare by enrolling in a Part D drug plan, which will kick out your Advantage plan. You want to make sure that you can get coverage with a Medicare supplement first, pass underwriting, before you enroll in a Part D standalone drug plan, which kicks out your Advantage plan. But again, between January 1st and March 31st, if you don't like the Advantage plan decision that you made, you have one more chance to change from Advantage plan to Advantage plan. But as of April 1st, you're locked into your plan until next fall. So it's important to check the drugs on your formulary, important to check the doctors in your network, all right? The fourth item on the cons list and things my clients don't like about Medicare Advantage plans are network restrictions. Very frequently, when someone has a Medicare supplement for a few years and they're accustomed to going to any doctor in the country that accepts Medicare, and then they switch over to a Medicare Advantage plan, they get upset when they have to deal with these doctor networks. Advantage plans typically either have an HMO network or a PPO network. With an HMO network, oftentimes you'll need to get a referral from your primary care doctor in order to see a specialist. If you go outside the network, you're going to pay 100% of the cost of that service unless it's an emergency with an HMO. You pay 100%. So if you're sick and you're traveling and you're in a different state, you get a cold or a flu, you don't feel well, you go to a doctor, you're on the hook for 100% of that. Now, a PPO is a little different. If the doctor's outside the network and agrees to the terms and conditions of your Advantage plan, that's a big if, then you can go to that doctor, but you're going to pay 30 to 40% of the cost of that service. So it's even higher than original Medicare at 20%. So you want to try to stay in network. Even if you have a PPO that gives you the freedom to go outside that network, you really want to stay in the network. So also, you must ask your out-of-network providers if they are willing to bill the Medicare Advantage plans. If they won't, you need to find another provider. We sometimes see the out-of-network doctors fail to tell the patient that they are not in the network, or maybe they're out of the network, but they don't agree to the plan's terms and conditions for out-of-network coverage. You're going to get an unexpected bill in the mail that's not going to be too much fun because you're going to have to pay it. Another similar network problem that a lot of my Humana Medicare Advantage clients back in 2016 encountered was halfway through the year, the Tenet Health, Hilton Head Hospital, Carolina Medical, just a ton of doctors in that Tenet Health network. Tenet Health said, we're not taking Humana Medicare Advantage anymore. So for a few months, my Humana Medicare Advantage clients had to go to Savannah to see a specialist or a primary care doctor because all the doctors in the Tenet Health network were not taking Humana Advantage. So that was a huge inconvenience. They actually had to go to a different state. Okay, and the fifth item on the cons list of things that my clients have traditionally not enjoyed about Medicare Advantage plans are prior authorizations. What are prior authorizations? So typically, private for-profit Advantage plans often require prior authorizations. Medicare Advantage plans often require prior authorizations to see specialists, out-of-network care, non-emergency hospital care, and a whole lot more, even routine medical procedures. So each Medicare Advantage plan has different requirements. So Medicare Advantage enrollees should contact their plan to ask if or when prior authorization is needed. Now remember, original Medicare historically has rarely required prior authorization. So originally, the Social Security Act did not authorize any form of prior authorization for Medicare services, but the law has subsequently changed, and there are some prior authorizations for durable medical equipment and physician services, things like scooters, motorized scooters. Despite the change, though, there are still very few services requiring prior authorization in original Medicare, all right? So, but just remember, prior authorization is a requirement that a healthcare provider obtain approval from either Medicare or a Medicare Advantage plan to provide a given service. They need to get permission first. Prior authorization is about cost savings. It's not about care, not about your level of care. So under prior authorization, benefits are only paid if the medical care has been pre-approved by either Medicare, if you're under original Medicare, which rarely is the case, or Medicare Advantage, which often Medicare Advantage will require prior authorization. Guys, just remember, Medicare Advantage plans are run by private insurance companies that are in business to make money. So it's in their best interest to double check to see if these procedures and tests or whatever, what have you, may be necessary, are really necessary. And you know what? Our client service team has dealt with these delays in service for sometimes days. It can even drag on for weeks because they're in business to help to put a smile on the face of the stockholders, not the policyholders. But that rarely happens with original Medicare. Okay, guys, the sixth thing that my clients hate about Medicare Advantage plans is coinsurance. What do I mean by coinsurance? Let's not confuse that with copay. Coinsurance is a percentage of the total cost of the procedure, surgery, or test. So I can guarantee if you're an Advantage plan, you pay 20% of whatever the cancer treatments are. You're going to pay 20% of whatever the durable medical equipment, wheelchairs, electric scooters, things of that nature. Part B, chemo drugs. You're going to pay 20% of all those chemo drugs and radiation, as well as a lot of Advantage plans require a 20% coinsurance for outpatient surgery, and as well, most plans are 20% for MRIs, CT scans, and radiology. But here's a scenario. It's October, all right? It's October, and you find out you have cancer, and you have to go on chemotherapy, all right? So in October, you start, not only that, but you're getting expensive Part D cancer drugs. Some of those cost $5,000 a pop. So you have to pay a percentage of that when you hit the catastrophic with your Part D drugs, 5% of the $5,000 cost of the drugs. In addition, you are going to hit your maximum out of pocket somewhere around December. All right, December. So in 2 months, you're going to hit your $8,300 maximum out of pocket. But guys, here's the problem. In January, you still got cancer. That's going to reset to zero. So you now have to spend $8,300 more before it shuts off and the plan pays 100%. You don't pay anything. So by February, March, you're going to hit your maximum out of pocket of $8,300. Again, that's the Medicare max out of pocket that they defined this year for 2023. A lot of the plans are more like $6,700, $7,500. But the point being is this: you could very well spend almost $17,000 between October and February or March in your maximum out of pockets if you do get cancer. Something to be aware of, and one of the things that you can do to kind of curtail those expenses is you could get a simple basic cancer plan or a indemnity plan that pays your 20% coinsurance for cancer and hospital and MRIs and things of that nature. We could customize a plan that would pay for all the charges that the Advantage plan doesn't pay, that fall on it's your responsibility, otherwise known as maximum out of pocket. So we customize plans that make up that $8,300 max out of pocket. So if you do get sick and get cancer, we have little plans that can pay all that for you at a very reasonable price that will help you absorb the high cost of these max out of pockets of Advantage plans if you do get sick. But also have a rainy day fund. You know what? Those years that you're healthy with a Medicare Advantage plan where you're not paying a monthly premium, put a little bit aside. Put $100 away each month towards that rainy day. If you do get cancer and you're on a Medicare Advantage plan, you can end up paying $8,300 in a period of 2 or 3 months. That resets in January. You can spend another $8,300 in February and March. So you need to be prepared for those kind of costs that are the maximum out-of-pocket costs that you will incur. So guys, the moral of the story on coinsurance is this. Most clients that we have are on fixed incomes. An end-of-the-year illness like cancer, they can face thousands in coinsurance, 20% of who knows what. So for cancer costs, I again reiterate the fact that you should get a cheap cancer policy just to hedge your downside. All right. I really do wish I could say everyone that left their Medicare supplement and their original Medicare to change into a zero or low premium Medicare Advantage plan is still happy. Some are still happy. They're healthy. Many are not, because the older we get, the more we have to utilize our healthcare services. And Advantage plans, let's face it, they have restrictive networks. They have coinsurance that can cost up to $8,300 per year, as outlined by Medicare for 2023. And you got a pre-authorization protocol by private insurance companies that, let's face it, a lot of times they're going to deny you for like a routine medical procedure, and they hope you go away. An interesting fact by the Health and Human Services Department said that 75% of all Medicare Advantage appeals that have to do with either your drugs or your medical, your Part A and your Part B appeals, through a Medicare Advantage plan run by a private insurance company, 75% of the time you appeal it, they're going to reverse that decision and they're going to cover whatever it is you needed in the first place. But that can cause days, sometimes weeks of delay, which leads me to believe if 75% of the time they okay it after they appeal it, they never should have appealed. They never should have denied it in the first place. But just remember, there's only two paths you can go down as far as Medicare. Think long and hard about that choice, or you can call me at 843-227-6725. Let us help you. And we're not just here today or this year. We're here for the entirety of your Medicare life. So we're going to help you through the turbulence which insurance companies can create sometimes with denials, with pre-authorizations, what have you. We're going to be there and hold your hand through this whole process. So have a great day. This is Chris Dewey with May River Medicare.